Good morning, Theodore from Student Paramedics here. Now, spring has come here in Australia. Summer is around the bend. Snakes and all sorts of little creepy crawlers such as spiders and scorpions are out and about. And I thought it'd be a good time to talk about how to manage snake bites and how to manage spider bites and other envenomations such as jellyfish and scorpions. Now here with me I've got the regulator snake and spider bite kit from MyMedEquip, and we're going to use this as we talk through a few of the management practices and procedures. Alright, so in Australia the cliche is true of a lot of dangerous animals. We have about 170 snake species, 100 of these are venomous, and we have about 85% of the world's most venomous snakes right here on our big island. And by venomous I mean that this animal injects a substance, i.e. venom, into the victim which causes life-threatening signs and symptoms. We're going to talk through a few of these, but these include myotoxicity, neurotoxicity, paralysis, and coagulopathy. So here's what happens when a snake bites you. You'll notice that the fangs on a snake are actually quite thin. And these fangs don't necessarily penetrate a very deep way into the victim's flesh. So the way that the venom actually gains access to the circulation is through lymph flow. So the aim which we seek to achieve when managing a snake bite is to retard the flow of lymph, therefore slowing and hopefully inhibiting the spread of the venom into the circulation. So in Australia, the pressure immobilization technique is utilized for all venomous snakes, including sea snakes, for funnel-web spiders, blue-ringed octopus, and for cone shell stings. On a side note, it is not recommended for redback spider bites, jellyfish stings, or stings by scorpions, centipedes, or beetles. So we're going to walk through the principles of how to successfully apply the pressure immobilization technique. We're going to find everything that we need to apply the pressure immobilization technique right here in this first aid kit. We've got pressure immobilization bandages, we've got splints, and we've even got a little dressing as well as a marker to mark out exactly where the bite was. In addition to that, we've got an ice pack for when the pressure immobilization technique is not appropriate, such as for the critters and the animals that we mentioned before. Alright, so let's open this first aid kit and see what we've got inside. And of course it comes with an inventory list right there. Once we open it up, we find that everything's pretty neatly arranged, easily accessible and identifiable. We've got the marker, as I said, to identify where exactly the bite was. Once you've wrapped the whole limb up in the pressure immobilization bandage, which we can find right in here. So the biggest thing in here, of course, is a splint. And that's really important because there's two principles when applying the pressure immobilization technique. Number one is local focal pressure and immobilization using the bandage, and then immobilizing the whole limb using a splint. And of course, the whole patient needs to be immobilized to slow down the lymph as much as possible. All right, so in here we've got a 4.5 meter snake bandage, and we've got a 10.5 meter snake bandage. Just depends on patient age, variation in habitus, and which limb you're actually immobilizing. But of course, you want to immobilize and bandage the whole limb as far as possible. Next up, you've just got a little non-adherent dressing should you wish to put that over the site of an envenomation. You've also got a little first aid guide which takes you through the steps quite nicely on how to manage a snake bite versus a spider bite. So you've got all the pressure immobilization technique steps right there, really nicely spelled out. You've also got a bit of spider identification. I wouldn't want to see any of those spiders between you and me. And then you've got management based on that. So that's not all that's in this kit. There's also a zipper pocket here. So in this pocket, we've also got a triangular bandage with which we can splint the arm to further mobilize it across the torso, or however is appropriate, depending on the patient position. And last, we've also got an instant cold pack here for those bites, which are not venomous snake bites. So bites such as the redback spider, jellyfish bites, these are appropriate to treat with an ice pack. All right, so let's move through and actually have a little look at how we apply the pressure immobilization bandage. So first of all, let's choose a cutting device. We'll choose the fake raptors from the last video. If you saw that one, and they've got great action here, as you can see, but they're going to be sufficient for opening this bandage wrapping. All we need is a little bit of sharp nick there, and there we go. Now the cool thing about the bandages which come in MyMedEquip's kit here is there are actually instructions on the reverse of the little paper here, and that will tell you how to correctly apply this bandage. Now, to retard lymph flow as much as possible while maintaining circulation and perfusion pressure, a pressure of at least 40 to 55 milligrams of mercury is recommended, and we get this range by applying the pressure at the tension which causes these rectangles to turn into squares. So that's the tension we want to keep around the whole limb as we are wrapping it. Now I'm going to be self-applying this, so it's going to be a little bit challenging. I've got a peg here to help me get started. Take our watch off first of all. And we'll just do a little preliminary wrap around so we can peg the bandage to itself. All right, so here we are, maintaining that pressure as best as we can. It's actually a little bit more tension than you'd probably put on a normal bandage, just to wrap a combine onto a bandage or something. unless you're really trying to maintain some pressure for swelling. Now, there is some debate in terms of where you start, whether to start proximal and then move distally, or whether to move from the distal aspect of the limb to the proximal aspect. The most important thing is that you get localized pressure right on that bite site first of all. That's where you want to focus, and then you can move around that. So you can start from the top with another bandage or from the bottom up. So there's arguments both ways. So if you start distally and move proximally, you may be aiding the flow of venom up the limb, which you really don't want to do. If you start proximal then move distally, you may cause a bit of distal edema, a bit of discomfort. Next up, for further mobilization, you can be really creative and wonderful with these foam aluminium splints. I really like to use them at work when I can. So you can make a splint with this to lock that arm in a certain position. So another little tip is to make sure that you do remove any jewelry which is on that limb, because if swelling does occur, of course, it's not going to be a fun time. Worst case scenario, you can use your ring cutters on a legit set of Raptors, not on this set of Raptors, because you would not be able to use them on this one. You know, it's not healthy when your trauma shears look like this and you're trying to cut. Okay, enough bashing the fake Raptors. Moving on to little things you need to look out for in your snakebite patient. Number one, neurotoxicity. This typically manifests as descending paralysis. So you may notice your patient's eyelids starting to droop a little bit. It's going to move down further and further, and it's going to eventually affect the diaphragmatic and intercostal muscles, which are used in respiration. So this isn't a nice situation if we get this far and the patient descends into respiratory arrest. In this case, they're going to be requiring ventilatory support with a bag valve mask. So guys, for an in-depth look at neurotoxicity in snake bites, I recommend you looking at this article on PLOS ONE. But essentially, the neurotoxicity is caused by competitive binding of the postsynaptic acetylcholine receptors. Another potential effect of snake envenomation is venom-induced consumptive coagulopathy, in which the clotting factors are activated by specific proteases, eventually exhausting them, thus developing coagulopathy. A few things that you might notice which may give hints towards this condition developing is bleeding from mucous membranes, and specifically from the site of envenomation itself. There's going to be a lot of pain. I haven't been bitten by a snake, and I don't want to be bitten by a snake, but from what I hear, it hurts a lot. A large part of this is caused by myotoxicity and necrosis occurring to the tissue around the bite site. This, of course, is going to cause potentially rhabdomyolysis and a large dump of metabolites and electrolytes into the blood, which can cause kidney damage. Therefore, one of these bandages is no substitute for getting medical help. Everyone who gets bitten by snakes should go to hospital for assessment. Tiger snakes are the most venomous snakes around here where I live, and about 60% of bites by this snake are serious. So if someone's been outside in the garden or in the bush hiking and they start developing headaches, blurred vision, difficulty speaking, pain, drowsiness, and of course you see the eyelids drooping there, really bad sign. If you see any of these symptoms, it's really important to assess them and ask if you can look at their limbs to see if they have been bitten by a snake, because surprise, surprise, not everyone who's bitten by a snake actually knows that they are bitten by a snake. So it's really important to check these symptoms. Sometimes it's being missed as an allergic reaction. Someone thinks they've just been outside in the spring, and on further examination, they find that there is actually little puncture marks on their lower leg. Now, moving on to spider bites, perhaps the most horrible spiders in Australia by which you could get bitten are the redback spider and the funnel web spider. So there are a number of big black spiders in Australia. The worst of these to get bitten by is the funnel web spider. These spiders are present around New South Wales and Queensland. If you get bitten by a big black spider in this area, you're going to assume that it's a funnel web spider until proven otherwise, and you're going to be going to a medical facility for assessment. Being bitten by a funnel web spider hurts a lot. There's going to be swelling and erythema at the site of envenomation. General symptoms may include agitation, headache, vomiting, abdominal pain. There's going to be a lot of parasympathetic effects, so there's going to be sweating, lacrimation, piloerection, and salivation. Haemodynamic instability is going to ensue. There may be hypertension, might be hypotension, tachycardia, bradycardia, pulmonary edema, all the good stuff. An important thing to note also, there might be some oral paresthesia, some fasciculations of the muscles and the tongue, and lastly, coma. So in your professional clinical application, you will be providing supportive care and ice to the site of envenomation. The definitive care for this patient is antivenom. Guys, I hope you found this video useful coming into summer now. Let me know if you did in the comments. Let me know if you have any suggestions. If you're interested in getting yourself one of these spider snakebite kits, then you can get them from MyMedEquip using code paramedic10 for 10% off. As always, please subscribe, hit the notification bell so you don't miss any of these videos. Give us a like and a share, and I'll see you next time. So guys, this isn't actually the first snakebite video we've done. We've done one before interviewing Kane from Wild Conservation, from which a lot of this snake footage came from in this video. In our interview with Kane, we go over an incident which happened where a carpet python actually transected his radial artery. There's footage of the incident, and there's a great rundown on what happened in that incident. So be sure to go and check that out, and check out Wild Conservation on YouTube, Facebook, and Instagram while you're at it.